Welcome to Behind the Mask, Episode 3, where real plastic surgery experts break down real-life cases from the most bizarre to the hottest trends. We're going to take you behind the mask to get unfiltered analysis from our true experts. I'm your co-host, Dr. Bill Adams, with my fellow co-host, the world-renowned plastic surgeon, Dr. Jason Posner from Boca Raton, Florida, as well as our special guest expert and Dallas plastic surgery consultant, Ellery Milliger. How are you both doing today?
I am doing well, and so is Cece.
Happy to be here.
Cece the Chihuahua is bring your dog to work today.
I think Ellery's doing better than me for sure. She says she's going to carry the show, so that's going to be good. So our first clip today comes from somebody who's no stranger to the plastic surgery channel, Ellery. You may know her, Pixee Fox, who's a famous plastic surgery enthusiast, and she's revealing to the botched boys a bizarre surgical procedure. So let's take a look.
Can you please send in Pixie?
Hello there.
Hello, Miss Pixie.
Wow.
Hey, you two haven't changed a bit.
I am proud over what I have achieved. I think it's amazing. I have new face, new body. It's a lot. I got elf ears, so he reduced my ears. So you can see they're quite pointy. I want to look like a cartoon pixie character, so pointy nose, pointy ears.
What else?
Oh, right.
You're laughing at the next one.
Yes, at a doll.
Doll.
A doll. I don't know what to call it because it's like, it's making it look, you know, I'm gonna use the word baby flower.
Your vagina looks like a baby flower. Sharing is caring. Thank you.
Take it away, Jason. You got the first comment on this.
I mean, I think like their story. I think they ran out of stories, so they're doing these like really bizarre stories. So just disclaimer: these are not the normal patients we see in our plastic surgery practice. You know, most of the people are not like this. Who are looking for this extreme stuff. Like I don't do pubic hair transplants to eyebrows, so that's out. So I'm not even going to talk about that. You know, but there are people who do these weird hair transplants. You know, there are specialists who do like beards and other things that missing spots. So like if that's what you want, go for it. That's not for me. The ears, making someone pointy ears, you know, pretty much I think that's ethically, that's something that we would want to do in our practices, making people look bizarre. So anyone who's kind of doing that, we kind of look down on that. But, you know, in terms of the vaginal rejuvenation, whatever you want. If you want things to look a little younger, a little bit better, as long as you don't want to do anything too weird, I'm okay with that.
I feel like too weird is an understatement because Dr. Adams brought up that we might recognize her in the plastic surgery community, and I genuinely thought that the reason that I recognized her was that she used to put money under my pillow when I would lose a tooth when I was younger. First of all, I don't know why she's at the botched office because she's talking about all of her escapades outside of the United States and the procedures she's had, so I don't really know what the purpose of her visit.
It's a complete gong show, right? I mean, even from the very beginning, the guy's like, please send in Pixee Fox. I mean, like, who sees patients like that? Nobody. I mean, it's like, it's a gong show, you know, and she's actually a very nice person. She was on this show. Actually, this show didn't exist because it's a new show, but there was a different plastic surgery channel show. We had her on. She was actually very nice.
I mean, but she's not, it's like the only thing I didn't understand is that's botched. She's not really botched. I mean, she's kind of extreme stuff, but like if she wanted to fix something that she had that was bad, she seems to like all the surgeries that she had.
I mean,
I remember
we
talked about her, like, didn't she have a rib out or something to get a little tiny waist?
Several.
Yeah. But the thing is, here's what we should do. We should have her on again because we could. It's like say she's just on display there and botched just so they can get clicks because it's bizarre and you know people, but it's completely not the real thing. It's not what we see every day.
She has a very pretty face. When you look at her in that clip, yeah, face is very pretty. The boobs are big. They don't look that crazy. You're in Texas, I'm in Florida.
It's like they're Florida big.
Yeah, like okay, they don't faze me. The waist is a little cinched for us, you know.
I mean, it's like the size of like a
Jason, her name is
soup can.
Pixee Fox. Okay, it's like.
I would love to sit down and talk with her. I want to know the type of surgeons she's been with. I would also love to interview those surgeons. It'd be a very, very extensive piece.
We got it. Book it, Ellery, and you can connect with her. You're in the social channels, not us. So. All right, so we're going to move on to the second case. So our next topic, it comes from US Weekly. The Real Housewives of New York star Leah McSweeney says she would support her daughter if she decided to get plastic surgery. So, this kind of thing seems to be more popular. What do you think, Ellery?
I've got several thoughts on this, not only on plastic surgery for children or for anyone that wants to, better their lives or feel better about themselves or fix something that was out of their control. But also for the fact that it's a real housewife, I think kind of makes me have some questions. I think when it comes to, depending on whatever age it is, there's plenty of procedures, whether it's a cleft palate or autoplasty, something like that. And so I don't really know what she's referring to, but I also don't know. I think we all binge watch The Real Housewives, but I don't know if 2021 we're really taking it seriously when they say that they're gonna let their 12-year-old get cosmetic surgery or injectables. I just think, in one ear and out the other. Very funny next episode,
I mean, I think there's, when you listen to them, there are some kid procedures we do on children, like otoplasty is done usually age 5 or 6. Rhinoplasty, typical age for some of the kids is 16. But traditionally we don't usually do 12 and 13-year-olds for cosmetic surgery unless it's something really extreme, some developmental abnormality. But the fact that she supports her kid, if she says, okay, I want my 12-year-old to have liposuction, I'd be like, ding, 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 probably not appropriate. But if she says, when my kid gets older and wants to have some plastic surgery, I'll support their decisions, that's like asking us, if you go get your oil changed in your car on a routine basis. That's what we do for a living. So if they want to get plastic surgery when they're of age, I don't give a crap.
I mean, I think back on my past and I'm like, Botox is, you can start it young, prevent wrinkles in the future. If I could have started Botox a long time ago, I probably would have.
When you were 13?
Yeah, sure. There's no way I would have been allowed. But, in theory, I don't know.
If you're 15 and you're a little overweight and your mother wanted lipo and you went to the doctor, I would be like, change your kid to a...
No, I think that's a different situation. I think establishing healthy habits at a young age is different. So when it comes to your kid's health, I think that's different. When it's an aesthetic thing, now we should definitely hype up being yourself and, using your best attributes and not paying attention to what you see on social media and all that.
Yeah, I would say I have a general take on this and a specific. The general take is okay, let's play word association. Reality TV, Gong Show. Okay, so it's these things. Botched, Gong Show, Real Housewives, Gong Show, and it's all about clicks. These guys don't. They talk about plastic surgery. My specific take is exactly what y'all are saying. They're throwing out plastic surgery everything under the sun is plastic surgery. Well, no, you have to qualify because absolutely, otoplasty, like you mentioned, rhinoplasty. Sometimes you'll do in younger patients. Even, if they're coming in and they're 15 or 16 and they want to get a breast augmentation because they think it's going to get a better boyfriend, no, total Gong Show. Nobody's going to do that. We never do that. But if they're coming in and they've got Poland syndrome, for example, that's a deformity and it's almost like a reconstructive thing. And you may put a expander in when somebody's 12 or 13 and their other breast is developing. And if you don't do something like that, they often have severe psychological issues. So in that sense, it makes absolute sense and everybody would do it and it helps the patient so much. But it's, that's just, she's talking, that's plastic surgery, it doesn't make sense. So it's unfortunate because I think it gives the general public who has no means to evaluate these things the wrong idea. But yeah, you have to qualify it.
I think not only qualify it, the basic thing is that plastic surgery, sometimes people assume, it's normal for people to assume plastic surgery is just super augmented breast or super big lips or something like that. And what a lot of the general public doesn't know is that plastic surgery is way more than that. And so for a mother to say that she would support her child getting plastic surgery, if you want to translate that as something, supporting your child starting those habits of being insecure at a young age, then you don't really know what plastic surgery is. It does improve the quality of life. That's the goal of plastic surgery. So improving the quality of life could be a number of things, deformity or, you know.
So if I told you, Ellery, okay, your daughter's coming in and we're going to explain to them about good skincare and sun protection and when to wear sunblock, would you think that's part of plastic surgery? Absolutely.
Absolutely, it's cosmetic, and I will do that with my children one day. I wish that I started moisturizing and washing my face at a young age, but I didn't.
My other take is that I bet you Leah McSweeney has no idea she said that. Somebody wrote that and they put it out there and they think it sounds good and they're trying to get clicks. It's all about the click. It has nothing to do about reality or any kind of learning point that's anything substantive for anybody in the world. It's about the click.
I bet you Leah is on our team.
Let's move on to the last case. So Jason, this is the clinical section. This is where we present a clinical case and have a little discussion. So Jason, what do you got for us?
So we're talking today about specifically some hand rejuvenation and also just fact of sun damage. So we were just commenting on the sunblock. So, we're talking about sunblock and what to use and what happens when you get to that extreme level where you're just kind of sun destroyed. Like I live in Florida, you guys live in Texas, and we'll see from some of the patients in my short PowerPoint, like not just hands, but chests and other things, like we can treat that stuff now. Like we were talking about just a second ago, good skincare. Well, back in the day, and the women who were older than me, so I'm 59, so I'll be 60 this year. So when you look at some of the women of my generation and a little older, and mostly women, not men, they used a lot of tan accelerators. They were out there like Magda from Something About Mary there with the iodine and the reflectors, and a lot of their décolletés and other areas of their body are just destroyed. So, let's screen share and look at a little bit about this. When you look at these problems, whether it's an arm or a chest, these are things we see clinically in our practices. We'll see patients like this in Florida and Texas and even in Minnesota if you're on your tanning bed, right? And we couldn't really treat this stuff prior to some of the new technology. I call this my Florida alligator. Like, which one's more sun damaged? Which one's got rougher skin? I guarantee you, if you felt the skin on the left, I'd probably rather be petting the alligator on the right. So, but this was part of the problem. Back in the day when we used this previous technology, it was fraught with problems. I mean, we left streaky patients, we caused burns, it was a damn mess. So that's why we came out with BBL Hero, and we really do all areas of the body. And if you just see me like do a chest on this patient, I mean, you can see this video. I mean, it's typically like it'll take me under 3 minutes to do a chest. You see the patient's very, very comfortable, and watch the chest starting to get red. It's just 2 passes in different directions, and you can see that's the first one. Follow the sped up clock there, and you can see like I did this lady's chest in, catch this, just under 1 minute and 30 seconds. Isn't that crazy how fast that is? And look at the redness on there. And you can see though she turned red, and you can see some of the results with this. One treatment, that's my staff member. A few treatments, another one. I mean, this has revolutionized our practice. We do backs, we do arms, hands, don't forget that. Legs we do with this. And this is the best real technology I've seen in a long time. The patients are super happy with this. Do you have patients for this, Ellery?
Yes, absolutely. I mean, down here in Texas, and then also just women in general, the chest is, we wear things that show our chest. And so it's exposed, it's vulnerable a lot of the time. Even when you're driving in your car, you're getting sun exposure. So I think that a lot of people are a candidate, whether they realize it or not. And the fact that we saw those results after just 1 treatment, and then even after 2 treatments, and it made such a difference, is just, I mean, I don't know who wouldn't be a candidate.
So I've talked to a lot of women about sun damage, and I think what happens is, just in terms of habits, a lot of women will take a shower in the morning, put their makeup on, which has sunblock in it, and they do a great job of their face. But a lot of them fail to put stuff on their chest, and they're wearing low-cut things, live in warm environments, and their chests keep getting bad and ruined, and their faces look great. So this is the time where we need to change their habits. Clean up your chest, and then change your habits. Like when you get out of the shower and you put your makeup on, put some sunblock on your chest. Really simple. And for that, you will protect that, and you won't really need to have this done again if you really protect yourself.
Yeah, I think in general, people are so focused on their face, they forget about the chest, the arms, the hands. That's a big one. With moisturizing, washing, retinol, things like that. And so the hero is a good chance to not only clear it up, but then to start good habits from there.
Yeah, in our practice, pretty much since we've got this technology, and Jason, you came down, we're offering it at IA Medical Supply, right downstairs here, and it's been great. Patients, everybody is a candidate. 100% of patients I see actually have, like Ellery saying, sun damage, and they're so excited there's something to do for it, and they're even more excited when they find out it's fast, it's painless, and the results, even after one treatment, there's great results. Usually they'll do at least 2 total treatments, but they even get really distinct results, as you showed, with one treatment, so it's fantastic.
Yeah, it's amazing to see results right away.
And it doesn't really hurt. It's very comfortable.
That's amazing.
You really come in, take your makeup off. If you have anything, you get treated, you're good to go. I mean, you can go play tennis or golf or lunch right away.
Like you were saying, there's other, we talked about décolleté, but even the hands are big ones, right? People are driving, their hands have sunspots on them, their arms, their legs, so it's just, there's so many different potential applications, and patients love it. Thanks for joining us this week on Behind the Mask. You can find us on our YouTube channel or theplasticsurgerychannel.com. For Dr. Jason Posner and Ellery Milliger, I'm Dr. Bill Adams. Until next time.